For the Apgar, the newborn is given a score from 0 to 2 in each of 5 categories: heart rate, respiratory effort, muscle tone, reflex irritability, and skin color. The assessment is completed at 1 minute and repeated at 5 minutes following birth.
The nurse auscultates the apical pulse to determine heart rate. If the rate is above 100 per minute, the infant receives a score of 2. If less than 100, a score of 1, and 0 if there is no heart rate. Respiratory effort is assessed by observing and auscultating the chest. A score of 2 is given if the infant is crying vigorously or if the respirations are spontaneous and regular, 1 if the effort is weak or irregular, and 0 if there is no effort. The muscle tone of a full-term infant is judged by the amount of flexion. Well-flexed extremities receive a score of 2, some flexion a score of 1, and if the infant is flaccid, the score is 0. The nurse evaluates reflex irritability by gently slapping the sole of the infant's foot or by inserting a catheter in the newborn's nose. A responding cry receives a score of 2. A grimace receives a score of 1, and no response is scored 0. Color is the 5th component, and the infant must be assessed for both central and peripheral cyanosis. If the Caucasian infant is completely pink, indicating oxygenated blood, the score is 2. The score is reduced to 1 if the hands and feet are bluish. If the infant is pale or if the body or face is blue, the score is 0. Because non-Caucasian infants may appear ashen gray, the mucous membranes of the lips, mouth, and tongue should be observed for central cyanosis. The scores for all 5 components are then totaled. A score of 8, 9, or 10 indicates satisfactory cardiopulmonary adaptation and requires no specific intervention. Scores between 5 and 7 indicate the need for stimulation and the administration of oxygen via bag and face mask. Resuscitation may be required if the score is below 4.